Dr. Limongelli, when it comes to implant, some doctors say that, there are the implants that go like instantaneously, literally one-day implants, and other people say there's a 6 months type of wait. Why would anybody want to wait 6 months if it can be done in a day? Or does not everybody qualify for one or the other? Tell us what the story is.
There are implants that are immediate loaded that you can do relatively quickly, but the most conventional type and the ones that have the longest track record of success are the ones that are placed, allowed to heal in the bone for 6 months until the bone actually bonds with the surface of the implant. It's called osseointegration. Once that occurs, the implant is very, very tight, and at that time it can be loaded. A little abutment can be screwed into it, and a cap can be made on the top of it, and the success rate is a lot greater. Those implants carry a 98% success rate. The ones that are immediate loaded don't have as high a success rate, but they are good for patients that want to have something there right away. They can have a temporary crown put on and eventually get a permanent crown put over it. The conventional implants, when they're put into the bone, have a cover screw that go over them that are pretty much flush with the gum line. And a patient can have a removable temporary appliance that goes over it, like a little small removable partial denture that they can function with and looks halfway decent. And they can wear that for 6 months so that they don't have a space there. And then after that, they can get the crown made. That's usually how it's done.
I see. So on an average, you would recommend to go with the 6 months procedure if in any shape and form possible?
I would, only because the success rate is a little more proven.
Okay, well, that makes lots of sense. I mean, I know we're living in a world of instant results and instantaneous everything, instant soup to instant everything. And in some cases, I guess that's okay, but we can obviously overdo it. And every so often, kind of planting the seed and building the foundation correct, and then be safe for, because basically what you doctors are saying is that an implant is, pretty close to a lifetime. It's there. It holds more or less forever, right?
Oh, yeah. I've seen patients that have very bad periodontal disease, that have lost all of their teeth, and they do very well with implants. The gum tissue heals very nicely around them, and they do preserve the bone. It's a very nice thing to see.
Wonderful. And so if something lasts then a lot longer, you're just simply better off doing it the right way. I mean, I'm sure all of us have done many things where the instant result was nice and good and beautiful, and then on the long run we, kind of regretted it, some things more than others, simply because we weren't willing to wait for it,
Yes.
Yeah, looks to me it's a little bit like, the guy who, the young kid who, let's say 18 or whatever, comes out of school and he decides to learn something, a decent profession, versus going and say, well, I can make some money tomorrow at Blockbuster and at McDonald's. Yeah, he will make more money right there, where let's say the other guy who studies something for another 6-7 years or whatever it might be, 4, 5, 6 years, he makes no money. In fact, he has almost a miserable life. He needs to study, he needs to, but that guy catches up very fast in terms of success in life compared to the kid who, went very fast to Blockbuster and said, oh, look, I'm making money. I can afford a little car now. You can't, because you have to go to school. But eventually catches up with him. And that's right. Like on an implant that could, on that type of stuff, it could be, a similar thing. It's maybe a bad analogy, but for all it's worth.
Okay.
Yeah. Good. All right. So, go and do it the right way. So that kind of like, gives us the idea that all this like one-day implant is not necessarily to flock to, because it's slightly second class in most cases, and many times you don't even qualify for it.
That's true.
Good. All right. Thanks a lot again.